Hi everyone, I hope you are having a good day so far. My name is George. I'm one of the outreach officers on this campaign called I See the Difference, which is all about trying to raise awareness of careers in the health service that aren't doctors or nurses but still make a difference every day that they're working. Joined with me today, I have got one of my colleagues, Rachel, who will be moderating this webinar and making sure everything goes smoothly. So if you want to give a quick shout out, Rachel.
Hi everybody, welcome to the webinar. If you've got any questions, are we going to take them at the end, George?
Yep, so we'll take all questions at the end. So we'll give you a chance to answer any questions that you might have as we go. Hopefully you'll send through lots of questions. We like answering your questions. It means that, you guys are really taking an interest and engaging with it. So we really love it when you send through questions. At the end of this webinar, about an hour or so after, you should receive an email with a feedback form. If you could fill this out, this would be great. It just means that we're able to constantly keep improving on our webinars to make sure that we're able to give the best possible information to you in the way that our audience enjoys. So we do try to take all this feedback into account. So just a quick overview of what I'll be covering today in the talk. So I'll give you a brief introduction of the allied health professions, go through a number of benefits that allied health professionals get to enjoy, an overview of the 15 professions that come under this term, allied health professions, and drill in a little bit deeper into 4 that are slightly lesser known, and then go through what you guys can do as mature students to kind of help advance your understanding of these professions and some things that you might want to consider along the way. And then just a quick summary and then some useful links that might be useful for you later on down the line. So starting off, what are they? I keep saying this term, allied health professionals, and I'm aware that most people probably don't know what they actually are. So just as a nutshell statement, what they are a family of professionals. So there's 15 different professions that come under this term, allied health profession, that make sure that adults and children can live the fullest life possible by either helping them adapt to or recover from some issues or injuries or illnesses that they might have experienced. There's 3 main ways that they achieve this. So they might be dealing with more acute short-term care. So that's helping patients in a really kind of short periods till they can recover from the injury, or potentially transfer them to a more secure facility for more prolonged treatment, as is the case with paramedics, which is one of these professions. Another way they do this is through talking therapy, so basically trying to help patients who might have maybe some mental health issues or might have issues where they're not able to communicate effectively, and just try to start working through those issues with them. And finally, it could also be through managing long-term health problems, such as conditions like diabetes or arthritis. So here is the family of 15 allied health professions. From now on, I'll probably just shorten it to AHPs, just because it's much easier to say than constantly saying allied health professions. There are some that you will probably never heard of, but there are a couple that probably might jump out at you. The first being physiotherapists. They're quite well known, and one which are absolutely everywhere is paramedics. If you haven't heard of paramedics before, that's quite a big gap in your knowledge, because they're always on the streets and they're quite frequently shown in TV series as well, particularly those more hospital-based. So that was just a quick introduction to these 15 different professions. There are a number of benefits to being an allied health professional. Firstly is the employability rate is really, really high. So any students that have studied a degree in one of these professions, 90% of them within 6 months of graduating are working as one of these professionals. So if you're looking for a job where you're almost guaranteed, or a degree where you're almost guaranteed a job at the end of it, the allied health professional courses are definitely a way to go. The 10% of other students doesn't mean they're necessarily unemployed. It just means that they've not gone on to work in their specific field. They may have taken their skills and transferred them to a different area or a different kind of sector. With a number of these professions, you can choose to work in the NHS if you want to, so working in the hospitals or working in community clinics, or you can choose to work privately, and this means that you get often a lot more control over your day-to-day working life, and it gives you a lot more control over the salary that you earn, and can also boost your salary a little bit more as well, because obviously when you are working in private practice, you're the one that's actually setting how much you charge patients, because it obviously isn't free like it is with the NHS. There's loads of chances to specialise, so obviously most people don't really want to just do the same thing day after day, time after time. It can get really, really repetitive, and it can get really, really boring. So it's really important that there are ways that people can specialise in advance and do more to make sure that the job stays varied and ensures that you keep your interest in that area. With a number of these professions, the patients that you're seeing, they are your patients. So you're the ones who are diagnosing them with the issues that they're having, creating a treatment plan, and then working through that treatment plan with your patients to hopefully have a positive result where they're able to overcome the issues that they are experiencing. Generally have quite good working hours for a number of these professions. The hours that you'll be working is Monday to Friday, 9 to 5, which really helps kind of fit into work-life balance, especially if you have a number of commitments such as a family, or purely you might just want to see your friends at the weekend and go out and have fun, which obviously can be quite high up on people's priority lists. That being said, there are some professions that do require some form of shift working. So as an example, paramedics, they are part of the 24-hour NHS service. So they do need to have shift workings to basically make sure everyone in an emergency situation is able to get that kind of urgent care that they require. Good thing about these professions are the entry requirements are often much lower than other professions such as medicine. They generally range from 2 A's and a B to 3 C's at A level, and equivalent for subjects such as access courses or BTECs. They're generally a lot more achievable. They do vary across degree to degree and from institution to institution, and it can vary based on popularity, of course, and the rankings of the university. So universities that are slightly higher in the rankings will often have their grades as a little bit higher as well. But the quality of teaching that you'll be getting is pretty much standard across the courses, because they will need to meet the requirements of the Health and Care Professions Council for accreditation. So every course across the country at different universities that offer these courses, the course material that is taught is almost exactly the same. One thing that obviously a lot of people care about, and obviously something that I care about as well, is having a good salary. As you graduate from any of these professions, you're able straight away to work as a Band 5 practitioner within the NHS. So these start at about 24,000, and if you were to do the same thing day after day, time after time, and not look to advance or do more, within 7 years of working, you would end up on that upper limit of about 30,000, which in itself is a pretty good salary. But as I said earlier, you know, everyone wants to do more and gain more skills in different areas and start advancing. And as you do, you're able to start applying for jobs that are slightly higher up in the band scale. So you've got a Band 6, which are known as kind of the more advanced specialist practitioners, and they start at about 13,500, and they go all the way up to about 37. You've then got the Band 7s, which are more kind of like the team leaders in the NHS, so you start getting into a bit more of the managerial role, and that's reflected in the slightly higher salary of 37,500. Then you've got the Band 8s, which are generally the kind of more consultant levels, or start getting into more mid or senior management. So you start at 8A, and that's 44,500, and you can go all the way up to 8D, which would be to put into a job role, kind of a head orthoptist or a head of department for quite a large department in a hospital. You've then got Band 9s, which are generally fewer and further between than some of the higher ones, but these are more for either the consultants or people that have gone on to specialize in, for example, surgery of podiatry, podiatric surgery. They would be working at a Band 9. So podiatric surgeons are someone who is trained as a podiatrist, and has then taken those skills and advanced and further training to then be able to perform surgery of the feet. They're not allowed to work any higher up. They are very much restricted to that one area, but it does mean they're able to actually earn quite a high salary. So often you hear people say you can't earn a good salary in the NHS unless you're a doctor, and that is completely untrue. So the next area that is quite a good benefit is more focused towards the actual studying period, and that's as a result of the NHS grant. So back in 2017, the government removed this NHS grant, which was there to support students from kind of supporting their study with their maintenance loans. And what happened was the amount of people that were going into these areas started to decline. They thought, wow, we need to have more people into these professions. So they reintroduced the grant back this year, and this will be eligible for any students studying 11 or 12 of these allied health professions. So those in purple are eligible for a £5,000, or those in purple and orange are eligible for a £5,000 non-repayable grant each year that you are studying. And that is purely to support your study however you choose. So it could be helping towards accommodation costs, or it could be help towards travel or equipment such as books or pens, or if you want to use it to kind of go out with your friends or see people or socialize, you're perfectly able to. The money is entirely down to you to spend however you want. The professions in orange are also eligible for an additional £1,000 a year, and that is because these professions are as a slight shortage in the NHS. And this is because generally, unless you know that these professions exist through use of their services, they're generally quite hidden away. They don't generally make for good TV on Holby City or Casualty, so they don't get as much media exposure as some other professions such as paramedics. In addition to this, there is an additional £1,000 support for childcare if you have any childcare needs. So there's £1,000 each year to support your childcare. In addition, there is also £1,000 strategic regions boost as well. They haven't actually announced which regions are kind of their strategic regions, but these will be areas which are also struggling to recruit as far as universities go, and more information will come out with that later on, and we'll make sure to update everyone. So those are some of the benefits. So what I'll do now is start to go into a bit more detail about what the allied health professions actually are and some of the skills and qualities that you might need to require to go on to be one of these professions. So with the skills and qualities, what we often recommend is searching for the NHS core values, and they're often represented through this called the 6 C's. So if you search those terms on Google, they'll come up with loads of information, and these are often what are used by both university and hospitals as part of their recruitment process to basically make sure that you have the core values as part of your personal self to make sure that you would be a good practitioner. So it's called value-based recruitment. But some of the key skills that people look for in these areas is someone who's caring. Obviously, that's the key thing for anyone working in the NHS. Often the people that you're seeing can be going through quite a tough time. So it's really important that you're able to be caring and compassionate as well. A problem solver is obviously a key area. So in issues where you are coming up with patients who might have some form of disorder, you need to try and work out what's wrong with them, and it does help to be quite a good problem solver. And this goes quite hand in hand with being curious as well. You need to be a really good communicator. Often you might have patients that aren't necessarily great at communicating themselves, and you need to be able to get your point across and basically make sure that the patient's able to clearly understand what is going on with them and what issues they might be having as well. You need to be very motivated. I don't think anyone can ever say any job in the NHS is easy. You do have to be motivated because it can be hard at times, but the reward you can get out from it can be incredibly rewarding. So motivated. And with many of these professions, it's also quite useful to have a keen scientific interest as well. Not with all of them, and I will go through those in a bit more detail in a second. So how can you become an allied health professional? The main route into any of these professions is through an undergraduate degree. So this would be 3 years of studying at a university. And as part of your university life, you will have placements which kind of integrate as part of your degree, where you'll spend time in the hospitals, working in the area that you are looking to go into, gaining your skills and kind of cementing your understanding and the practices that you need to be able to perform. So when you come to graduate, you already have all the skills in your tool belt, so you can go straight out and start working as one of these practitioners. There's no requirement for a pre-registration year like some other professions such as pharmacy or optometry. So that's the main route, the undergraduate route. There are some other options as well. So apprenticeships is a slightly more new and upcoming route. It's not necessarily as well established in all professions, and some there aren't any apprenticeships available. The best place to look for information about apprenticeships in your area would be the apprenticeships.gov.uk website. So that's apprenticeships.gov.uk. As they have a full list of the different professions in the health service that actually offer apprenticeships. The other route through is postgraduate study as well. So if you've already done an undergraduate degree, but you think maybe an allied health professional course might be for you, there is the option of either starting again and doing another 3-year course, much like the undergraduate course. And if this is your second degree, you would actually be eligible for student finance support as well, because the government recognises these areas as a region or an area that requires that additional kind of workforce. So you are eligible for additional funding there. Some courses actually also offer a postgraduate entry as well. So instead of a 3-year course, you would do a 2-year course instead, and be able to go straight into year 2. And that just means that obviously it's a little bit quicker towards completion and start working, and more importantly, earning money. So what I've done here is try to break down these different professions into different categories to kind of separate them into different people's interests. So you've got the first, which is slightly more creative. So there are 3 professions here which are very, very creative and not really that scientific based. So this is art, drama and music therapists. So these professions are all about trying to help patients work through maybe some issues that they have, or some traumas, or maybe mental health conditions, through various types of media, in these cases art, drama and music. With art therapists, it could be helping patients who might have had issues through artwork. So the art therapist would get the patient to create a piece of artwork, either a drawing, maybe a sculpture, and then kind of help get them to start discussing and have a bit of conversation about what this artwork might represent for how they're feeling or kind of their emotions, and just helps them start kind of communicating based on a projection of what they might be feeling rather than describing how they feel, because that can sometimes be quite difficult. It's very similar for drama therapists as well. It's all about trying to help with either role play, simulation or movement as well. And with music therapists, it could be helping through music. It in itself can be quite relaxing, but it could be creating lyrics or songs to help try and express themselves in a slightly different way. With these 3 professions, they're actually all postgraduate degrees. So you would do an undergraduate degree in either art or drama or music, and following a bit of experience and volunteering, you'd be able to do a 2-year postgraduate course in either art, drama or music therapy, and that would teach you how to use your skills in art, drama and music as a form of therapy for patients. You've then got some which have got a slight mental health focus, so including the art, drama and music therapists. There are 3 other that kind of fit this umbrella for mental health. There is a lot of crossover you'll find with these professions. So with occupational therapy, for example, you have the mental health focus of maybe dealing with patients who might have agoraphobia, which is a fear of open spaces, and working with them to try and start doing more and more so they're able to start combating some of the issues that are kind of causing the phobia to develop. And it could be something as simple as working with them to create small realistic steps so they're able to do things such as get to the corner shop to buy themselves a pint of milk. which for you and me, that sounds like not much at all, easy. But for them, you might as well ask them to climb a mountain because it seems that impossible. From the more biological perspective, it could be aiding patients who have had a stroke or have had some form of condition where they've had an accident, for example, and they're not able to do everything they used to do. With occupational therapy, it's got the term occupation in, but it doesn't necessarily just mean about jobs. The occupation is something that occupies your time. It's all about the activity. And it could be a case of helping patients find ways of adapting so they're able to help themselves get on and off the toilet by themselves, which obviously seems like a relatively simple task for some, but if you're unable to do that, it can have a real impact on your independence as well as your dignity as well. So it's making sure that patients are able to do everything that they would normally do before an accident. It could also be from a workplace perspective, talking with employers about ways they could adapt their daily working to ensure they're still able to carry out their job, such as if they have lost the ability to move without a wheelchair, work on the ground floor so they don't have to then take the stairs and can still carry on with their daily life. With dietitians, they, from the mental health perspective, could be working with patients who might have eating disorders, and it could be working with them to try and create a way of eating in a much healthier way, because often issues such as anorexia can arise from patients feeling like they don't have enough control over their daily life, or they're a bit out of control with their life, and the way they kind of get a bit of control back is through their diet, but it's often manifests in a really, really unhealthy way. The dietitians can then work with them to try and get a bit more control over that, so they're eating in a much more healthier way. From the more biological perspective, it could be working with patients who have got issues such as diabetes, or they might be overweight, and trying to create meal plans to make sure that patients are able to get the correct nutrition. People often ask what the difference between a nutritionist and a dietitian is. Anyone can call themselves a nutritionist, but not everyone can call themselves a dietitian. So a dietitian is someone who has done a registered course in dietetics, and then has chosen to register with the Health and Care Professions Council as a dietitian. So anyone can be a nutritionist, but only a few people can be a dietitian if they've done the required course. Lastly, we've then got speech and language therapists. So speech and language therapists are working with patients who, from a mental health perspective, might have developmental complications. So, for example, with young children who might not be communicating as fast as the rest of their peers, working with them to start improving their communication and their speech, so they're at the same level as their friends. They might not be disadvantaged later on in life. It could be from a more biological perspective of dealing with patients who might have had a stroke and have lost the ability to speak, and again working with them to try and regain that level of communication. Or it could be dealing with patients who have got a degenerative condition and over time will start losing the ability to speak. So, for example, Stephen Hawking, who had motor neuron disease, over time gradually lost the ability to speak, and he was then fitted with a computerized voice which enabled him to communicate, and that would have been set up by a speech and language therapist. We then have some which are slightly more high pressured. That's not to say all the other professions are completely stress-free or pressure-free. These are just professions that have got quite a bit more pressure, where in some cases patients' lives are very much in your hands. So starting off with operating department practitioners, otherwise known as ODPs. These guys kind of act like the coordinator of an operating theatre, and act as like a runner or a link between the different practitioners that work in the operating theatre. Because in the operating theatre, it's not just a surgeon, you'll have the anaesthetists who are making sure the patient's staying asleep, you'll have the surgeon who's performed the surgery, the theatre nurses who are assisting as well, and the operating department practitioner kind of acts as the conductor of a medical orchestra. And they'll be with the patient throughout the whole procedure of the surgery, both in the pre-operative, informing the patient of what's going to happen in their surgery, as part of the actual operation itself, either helping with the anaesthetist is one area they can specialise in, is anaesthesiology, or they could be a bit more on hands-on in the scrub side, which is actually assisting the surgeon with the actual surgery, either helping him count the tools in, and really importantly, counting the tools back out. There are a string of cases a while ago where some tools went in, they didn't all necessarily come back out, and the patients left a little bit more magnetic than when they first went in. They're really hot on that now, and it rarely ever happens, and that's all thanks to a lot of the procedures that have been put in place and carried out by the operating department practitioners. And then they will also be involved in the post-operative care of the patients as well. There's then also the paramedics. I won't go into too much detail about paramedics. As I said, most people generally know about them, but they are very much on the front line, prepared for any situation that's thrown at them. One thing that with this profession, students that go into this area do have to have quite a high level of resilience, because you do need to be prepared for almost any situation, and it can be, very high pressure situations. The next area could be those that are slightly more physics based. So you've got diagnostic radiography. So diagnostic radiography or diagnostic radiographers are practitioners that, if you've ever broken a bone, you might have gone to see to have an X-ray done. And they use radiation and really high-tech pieces of equipment as a form of imaging for diagnosis. So as an example, my uncle quite recently fell over and he broke his arm. He broke it in 3 places, very unfortunately. So he went and got an X-ray, and this was then performed by the diagnostic radiographer. And people often think that all they really do is take a photo and send through to the doctors, but that is not at all the case. What they'll do is they'll position the patient correctly, take the image, and then they'll basically analyze the image and annotate in different areas that are worth noting to the doctor. And they'll then send that through to the doctor, who will compare the imaging with other tests that he's ordered to create an overall picture of the patient's health. And then pass that on to the patient as with a form of treatment. There are a number of other professions here as well that are slightly more physics-based. So, for example, orthoptics, prosthetics and orthotics, and therapeutic radiography. But I'm not going to go into those in too much detail right now, just because I'm going to talk about them in a lot more detail shortly. So there are some that are slightly more biological-based. So, for example, we have physiotherapists. So physiotherapists are all about trying to rehabilitate patients after they've had some form of accident or sporting injury. So, for example, my uncle, when he broke his arm, he's recently had his cast off and he's now having some form of physiotherapy treatment. He was initially having it in person and going to the hospitals, but he is now continuing to have his physiotherapy treatment over Zoom, which in itself is a challenge for him because he can't use computers. But it does mean that he's still able to get his treatment and have his condition monitored by the physiotherapists to make sure he's still able to continually improve and do things he loves, such as making a cup of tea and having some toast. This area can also be quite sporty as well, largely because if you think about Mo Farah and Mo Salah and all the other Mo's that do sports, they will have a team of physiotherapists behind them, basically making sure they're able to perform at their absolute optimum, because their ability to win is their ability to be the best, and unless they can do this, they won't be able to. So they'll have that team of physiotherapists to make sure they can work at their optimum. If you've ever seen in a football match someone who's fallen over and sprained their leg, they won't often have the team doctor run over, they'll have the team physiotherapists run over to assess the player. There's also osteopaths as well, which kind of work in a similar area in looking at improving mobility in patients, but they're a lot more hands-on and less into the sports focus. They do have sports focus as well, but it's less kind of on the pitch. It could be, so you may have seen videos on Facebook or Instagram of patients having adjustments and having their backs or necks cracked. This is often performed through osteopaths. So osteopaths are absolute experts of the human anatomy, and often from the way that patients are holding themselves with their posture and the way they're kind of leaning, they can often tell what's wrong with the patient before they've actually assessed them. And through a series of adjustments and manipulations to the human anatomy and to the bones and joints, they'll be able to start relieving some of the pain that patients are experiencing. And I've seen videos on Facebook where patients have literally not been able to walk in, have had to be wheelchaired in, and by the last appointment and adjustments, they're almost completely pain-free and able to walk around completely unaided, and it can be really, really rewarding. So I mentioned this just briefly, so there are some that are slightly more sporty. So you've got physiotherapists, again, covered this with podiatry. I'll go into this a bit more in detail shortly. Same for prosthetics and orthotics, and osteopaths already covered. You've then got one which is very much more engineering based, and this is the prosthetics and orthotics. With prosthetics and orthotics, it's more to do with looking at the actual structure and device that you're creating rather than the actual human biology. So it's much more engineering or mechanics based. And then finally, we have these four, which are slightly lesser known. So this is podiatry, orthotics, prosthetics and orthotics, and therapeutic radiography. And these four I'll go into a bit more detail now. So going into the lesser known. So we have orthotics. The first thing to say is an orthoptist is not an optician. So an optician is more on the high street. So for example, your Specsavers types of optician shops. And they're looking at more whether patients need prescriptions in their glasses to be able to see clearly. If there's issues such as double vision or problems with the connection between the eye and the brain, they'll often refer them through to either an orthoptist or an ophthalmologist, who is a doctor who is specialised in eyes and focuses a lot more in this kind of surgical area of the eyes. So an orthoptist is more based in a hospital, the kind of working like a GP clinic, so not an actual GP clinic, but the kind of way of working is very similar. So they'll see the patients, diagnose them with the problem, and then start working through a treatment plan with them to hopefully help them overcome the issues. They're absolute specialists of the eye and its connection to the brain, as well as the connection with the brain and the muscles around the eyes, which can, when not correctly working, can cause a number of different eye conditions. Their main role is to diagnose and treat problems affecting patients' eyes, especially eye movement. So one condition which is really, really common and is kind of the bread and butter for an orthoptist is seeing patients who have double vision. And this is double vision that isn't corrected by glasses. And this can be caused from a whole host of different areas, from anything as common as high blood pressure to anything as sinister as a brain tumor. So it's really, really important that we have these professionals there scanning and making sure that patients' eyes are working properly to try and reduce this double vision and just to make sure there's nothing sinister going on behind the scenes. Another condition that they might look at is patients who have got a turn in their eye, also known as a squint. This can arise from a muscle imbalance around the eyes. And the way that this can be treated is through a number of different ways. So it could be exercises to try and strengthen the muscles around the eyes, to basically balance them, so that way eyes are able to face forward together as a pair. It can also be through a prism, which is a piece of glass or plastic which can be put into your glasses, and it almost tricks your brain into thinking both eyes are facing forward. And it does this because it bends light. That's where the physics really comes into orthoptics. There are slightly more invasive ways of improving this. So you could go in for surgery, and this will often be performed by the ophthalmologist, so a doctor who specialises in eyes and eye surgery, and the doctor will detach the muscles from the eye, or specifically the weaker muscle or the stronger muscle, and then reattach it in loosely in a slightly different place. The orthoptist will then do a visual assessment of the eyes to make sure they're aligned and in the correct position, and then the ophthalmologist will put in a small permanent suture into the eye so that their muscles are fixed in place. Another way that you can also do this is, and can be performed by an orthoptist if they chose to specialise in this way, is through Botox. So the way Botox works is it paralyzes muscles, which is how it can get rid of wrinkles in people's foreheads if they choose to use it. And what you can do is you can actually inject this into the muscle of the eye, specifically the muscle that's stronger than the muscle on the other side. So if, say for example, the muscle on my right side of my eye was stronger than the muscle on my left, my eye would be turning to the right. So I could inject Botox into this muscle and it would weaken it. And as it does, you can actually see the eye turning around to face forward. It's really, really cool, but I can appreciate how a lot of people would find this very gross. I did biology and I love all things slightly gory. Good thing about this profession is, though, as gross as that can sound, there is no blood. So if you're someone who doesn't like blood, it's a very good profession for that. They also treat conditions such as lazy eyes, which is where the connection between the eye and the brain, the nerve cells just haven't developed properly for one of the eyes, and the brain's just relying on the fact that one eye can see clearly, and it carries on and doesn't try to develop the nerve cell connection. So what you can often do is you often see young children walking around with eye patches covering their eyes, and this is to try and stimulate the growth of the nerve cells that connect the brain to the poorer eye. So you're covering the strong eye with an eye patch, basically removing your brain's reliance on this functional eye, and forces the weaker eye to basically work harder and your brain to think, wow, I actually now cannot see, we should do something about this. Unfortunately, after the age of 8, lazy eye is pretty much cemented and can't be fixed. So that's why you often find orthoptists working in the community, particularly in primary schools, doing scanning and screening of children's eyes to make sure that they're working at the correct level. And if they're not, try and improve their level of vision. With this profession, loads of chances to specialise. You can go into lots of different areas such as research, neurological, diabetes. You could also go into kind of stroke or research or management as well. The next profession I'll talk a bit about is podiatry. So podiatry is all about trying to take care of people's feet and lower limbs, and they can do this through a number of different ways. They have lots of different areas that you can specialise in, and it's really important that we have these practitioners here that are looking after patients' lower limbs, because I like to think of people as houses, just really weirdly shaped houses that move. But if you don't take care of the foundations, you'll often find that you start getting problems slightly higher up. So if you think about it, if you ever hurt your ankle or you've pulled a muscle in your foot, you often find that you're walking slightly differently. And that change in how you're walking can then start having effects slightly higher up. You might start getting pains in your hips, or you might start getting problems elsewhere. So it's really important that you take care of these lower limbs and have really good foundations to prevent these issues from arising higher up. In an average person's lifetime, you will walk about 150,000 miles. 150,000 miles on the set steps, but that's not that much. So if you think about it from a point where you're slightly older, your feet aren't going to look as they did when you were younger. So it's really important that you do take care of your feet. Podiatrists might look at patients who have got calluses, so a build-up of slightly hard, dead skin, and try and treat that. Might look at ingrown toenails or verrucas and warts, and treating that by really cold liquid nitrogen blast to the area, killing that fungal infection, and then start enabling patients to be able to recover and start doing a bit more movement. They can specialise in different areas, so they might look towards working with sports, kind of focusing more on sports podiatry. And a lot of patients that get into this area kind of go from the fact that they are really into sports themselves. For example, running. You'll often see a lot of runners as a podiatrist, making sure they're able to carry on doing the things they love, pain-free. There are areas that specialise in forensics, as well as other chronic conditions such as diabetes and arthritis. Particularly with diabetes, you do need to work in a kind of multidisciplinary group with doctors and nurses, because the issue that you have with diabetes is the further you get away from your core and your heart, the poorer your circulation can be, and your feet and lower limbs are quite far away from your core, which means that if you get an infection or you have a cut or an abrasion, it can get infected, and then if left untreated, it can then start to become septic and get a bit out of control, and this can then result in amputation or removal of limb. which obviously is the last thing that any practitioner would want to happen to their patient, and it's obviously the last thing any patient would want to happen as well. It would have a giant impact on their independence and would have a huge knock-on effect to their mental health as well. So it's really, really important that you have these professionals that are there to basically be able to treat these conditions. With this profession, you'll find that a lot of people also choose to work privately as well, not just within the NHS. And you'll find that people will have set up kind of clinics either in their back room of their house or in different places, or in kind of an actual clinic facility. And it just means that you get a lot more control over your working life and the money that you can make as well. So the next one that I'm going to talk about is prosthetics and orthotics. So with this profession, you actually do 1 degree in prosthetics and orthotics. And what this does is it trains you to work in 2 different areas. You can either be a prosthetist or an orthotist. So a prosthetist is someone who creates artificial structures to replace a limb. So like this gentleman here, he's been fitted by a prosthesis. So this is an artificial structure to replace his limb. And this is then produced by a prosthetist. You then have an orthotist who creates an artificial structure to support a limb, kind of like a scaffold or a splint or a brace. This is called an orthosis. And this is why this profession is more kind of biomechanical or bioengineering, because you're not looking so much about the actual patient and their biology. What you're more looking at is how the device you're producing can fit and adjust and adapt to the patient's anatomy and their biology. So while there is some biological focus, it's not heavily biological based. These devices are very much made to fit. It's very rare that you'll find that these devices are just taken off the shelves. They will be a cast will be made of the patient's limb, and this will be then used to produce this device, which is unique to the patient. Often what you'll find is that generally the relationship that's formed between practitioners and patients can be quite strong, because over the course of your life, you'll find that your body composition will change. You might get bigger, you might get smaller. If you've had a developmental issue and you didn't, and a patient doesn't have a fully formed limb, they might see one of these practitioners from a very young age up to adult age, and obviously the type of device that they would need would change quite a lot over time. Part of the role of a prosthetist is to help people adapt to these new devices. They often work quite closely with other practitioners such as physiotherapists as well to basically help with that rehabilitation. And as I've said, it's very much a biomechanics profession as well. So last one that I'm going to talk about in a bit more detail is the therapeutic radiography. So with this profession, what you're largely doing is using radiation as a form of treatment for a variety of different diseases. Quite largely, you're treating cancer patients. So you'll notice the name quite similar to diagnostic radiography. So diagnostic radiography uses radiation as a form of imaging for patients. With therapeutic radiography, it's all about using it as a therapeutic treatment. So you'll notice the really high-tech piece of equipment in the middle. So this is called a LINAC machine or LINAC. And the patient will lie down on the little bed in the middle, and then they'll then be positioned really precisely on the machine, and this machine which is kind of look like a half donut, will be used to administer a really precise dose of radiation to either a cancer or a tumor. And the way that this works is the machine, the half donuts and the little bit at the top, can rotate all the way around the patient, and it can even go underneath as well. So if it needs to administer a radiation from behind or in the back, it can be used to basically introduce these mutations, because the way cancer is able to grow so out of control is a mutation will have been introduced into a healthy cell that wasn't picked up by the immune system. And then this will have had an effect on the healthy cell's ability to regulate its own growth, where instead of it being able to go grow, die, it's lost that function or that regulation. So it just goes grow and grow and grow and grow until it gets completely out of hand and creates this mass or a tumor. But as part of its loss of regulation, it also loses its ability to check itself or repair any other mutations that are introduced to the cell. So what this radiation does is, this radiation is blasted into the cell and it introduces loads of new mutations into the cancer cell, which prevents the cell from actually being able to grow anymore. It loses its function to even grow. And this means that patients are, or the immune system is able to come in and hopefully mop up these cancer cells and remove them from the system, so patients are able to recover from these conditions. Obviously, that is the hopeful goal, and in many cases, this treatment can be used to cure a number of cancers. But in some cases, it can't always cure the patient of their cancer, but what they can do is prolong the amount of time that they will have, which gives them obviously more time with their family and their friends. And because of this, this is a profession where, another one where you do require quite a high amount of resilience, because in some cases it can be really, really happy and you can, cure people of these conditions such as cancer, but in some cases it's not always possible. So you do need that, quite high level of resilience. It is a really caring profession as well. I don't think I've met a therapeutic radiographer so far that I haven't liked. They're all very nice people, and they have to be, to kind of make sure that they're treating the patients with the respect and care that they need, and not just the patients as well, but also the families that's going through this condition, because whenever anyone is going through a condition such as cancer, it's not just the patient that's going through it, it's the whole family as well. So they are a very supporting profession. And as I've said, it can be immensely rewarding, because this profession, you literally can cure people of cancer. So those are the 4 lesser known ones. So I'll quickly go into what can you do and some things that you could consider as a mature student. So the first thing that I would recommend is reaching out to some of your networks and try and find any volunteering or work placement experience that you can get. Often you might find people getting a lot of red tape coming up from the same work experience. Generally, if you say that you're looking for some shadowing experience, so this is experience where you're able to basically say, I don't want to do anything, because as soon as you say experience, hospitals think you want to be really hands-on, which often people aren't that qualified to do. So if you say shadowing, it just means I just want to sit in the room with you when you are talking to a patient, and often that can get through a number of barriers within hospitals. One thing to consider, and one thing to definitely look at different universities, is not all degrees will be able to guarantee a placement close to home. So if you have family commitments, or you're just not able to travel quite far away for potentially a few weeks at a time, some of these professions might not be kind of fit for fitting into your life. Best thing to do would be to speak to different universities about this to find out what their placement programs like and whether they can make adjustments for that. Some will try and make adjustments for mature students because they do appreciate the difference in commitment. One thing that is quite good is the NHS does have a dual accommodation fund. So if you have a house already but you need to have accommodation elsewhere, so if you've had to have, say you live in Liverpool, but you have to do a placement in Exeter, there is actually a fund to basically support this accommodation, so it's not coming out of your pocket. So often can relieve a lot of the issues that students might find. I'm sorry. Look into university open days and speak to some of the academics and some of the current students to find out how they're finding the course. Particularly if you can ask to speak to any mature students, often universities are very much willing to do that. If you do want to find any universities that offer any of these courses, we have a really nifty course finder on our website, which is iseethedifference.co.uk. I'll put it up at the end. And there's a course finder which will tell you every university in the country that offers all of these courses. So it makes it really easy to find it by area and by profession. Make sure you have a good understanding that with these professions, once you started on the route of these different professions, you are having a commitment to training. There's something called continuing professional development, and it basically means that you are making sure and can prove that you're staying up to date on the most relevant developments in your field. One thing which a lot of people care about quite a bit, particularly mature audiences, is about student loan. And often people will think that they're either not entitled to student loan or that they'll be paying back a fortune, and it's not really worth all this restudying. And often these things are quite often myths. So at the point you come to retire, your any student loan repayments that you will have will stop. So you won't be paying any more student loan when you get into retirement age, because you'll drop below the threshold at retirement, and you'll just stop repaying your loans. And finally, student loan repayments are much less than you actually think. There are horror stories of paying hundreds of pounds a month back, and this really is just a myth. So here is a figure that I have stolen from the student loan company. So if you ignore the middle bit, because that's one of the old student loan entitlements. So if you remember back to the different bandings of the NHS, as you graduate, you'll start on a band 5 salary, which is about 24,000. Anything below the income of 25,725, you will pay nothing back. So you don't pay anything back off below 25,725. And then anything after that, you pay 9% on. So if I was to earn as a salary, very specifically, £25,726, I would be paying 9% of £1, because I'm £1 over that threshold. If you then think about band 6 salary, which started at about 30,000, so good salary, you're then only paying back about £32 a month, which obviously is money, but it's a very small amount of money in the scheme of things. So that's then paying, as I said, it's 9% on top of the threshold. So it is relatively low, and it really isn't that big of a deal. It's more of a contribution to your education rather than a debt, which is how it's often advertised. So as a quick summary, these are professions where you really can make a difference to people's lives, and it can be really, really rewarding. There are so many professions, and they're so vast and so different between them, that there is one to meet almost everyone's interests. Make sure you take advantage of all resources available to you. I'll give you some useful links in a second, and we can go through some of your questions. And just make sure, finally, that the degree that you're looking to go into really does fit into your kind of life, because you want to make sure that you're not having to change your life too much to accommodate this profession or degree. So finally, we have these links. So we have the website, which is iseethedifference.co.uk. So that's our website. And you can use this to find the course finder, which will tell you all the different universities in the countries that offer these courses. If you have any questions at any point, feel free to send us an email at info@iseethedifference.co.uk. And we are also on Twitter, Instagram, and Facebook at iSeeTheDifference. And you can also look into, it's called Step Into the NHS. It's a really useful quiz on there, which will tell you how to, or it's a quiz that will kind of tell you, based on your interests and your areas, what jobs in the NHS you might be well suited for. It's not just specific to the allied health professions. There are 350 different jobs in the NHS, and it'll map you based on your personality to a job. So at this point, see if we have any questions. I'll hand over to Rachel, see if we have any questions.
Hi George, so we've got one question which is about funding, and that is the extra £1,000 grant applicable to Northern Ireland?
So as far as we believe, yes, there was some information that came out recently that said, as long as you are studying in England, everyone from the UK is entitled to this funding. It may be different there may be funding available from different NHS, for example, NHS Scotland, but NHS England will give this to any United Kingdom resident who is choosing to study in England.
Yeah, I think also, if we think back, we did have a document, didn't we, George, which outlined the information about funding.
Yes.
And I'm just checking back on that, and it's in it says this offer is available to students ordinarily resident in the UK and studying courses in England only, which is what you've just said. But it does actually have a little caveat, which is decisions about the NHS workforce in Northern Ireland, Scotland and Wales, including the funding that they provide for students, are a matter for the devolved administrations of those countries. So I guess the message there is that if you're looking to study either over in England or back in your kind of home country, then you really need to do that bit of due diligence and double checking.
Great. Do we have any other questions?
No, that's it.
Fab. Okay, well, in that case, if you don't have any other questions, or you do have any other questions that you thought of after this, feel free to get in touch at our email. Again, that's info@ICT-Difference. Again, we would really appreciate any feedback that you have, so keep an eye out for that email that should be coming to you shortly. But if not, have a great day. If you have found this really informative, and yeah, I just hope you keep well and keep safe. Thank you very much. Bye, guys.
Bye.